criteria as of 2014. This is Christy C. I am a registered nurse with a master's degree, and I am GI certified. I am a committee member of the ABCGN GI Audit Committee. Disclosure. The American Board of Certification for Gastroenterology Nurses, otherwise known as ABCGN, is accredited as a provider of the CGRN Program of Continuing Education by the Accreditation Board for Specialty Nursing Certification. Relationships with commercial entities and organizations whose products are related to program content is known. The purpose of this presentation is to provide information on the GI-specific application process and the criteria for obtaining GI-specific continuing education credits. Our mission is to maintain and improve the knowledge, understanding, and skill of nurses in the field of gastroenterology endoscopy by developing and administering a certification program. Certification is a voluntary process by which a non-governmental agency, such as ABCGN, validates that a registered licensed nurse has met the standards for specialty practice specified by members of that profession. The purpose of certification is to assure other professionals and the public that the person has mastered the knowledge and skills necessary to practice in the specialty of gastroenterology. Objectives. We're going to review the overview of the submission process, what is considered GI-specific, overview of GI-specific criteria related to gastroenterology and hepatology, what is non-GI specific, an overview of non-GI specific criteria, and a conclusion. For the submission process, complete the application by clicking on GI-specific hours approval under Resources at www.abcgn.org. If your program was submitted to SGNA, your objectives will be forwarded to ABCGN once you have submitted the ABCGN application. You will need to submit a copy of your program flyer to ABCGN as well. If your program was not submitted to SGNA, you must submit your objectives along with all other requested materials with your ABCGN application. Please allow 30 days for program review. Note, GI-specific approval cannot be granted until contact hours are final, and the application fee for GI-specific review is $35. For the submission process, this is the ABCGN GI-specific review form that you would need to submit. You need to submit this form if you have not gone through the SGNA process. You can submit this form along with the application and the required information. For the submission process, this is the information that will be required with your submission, with all of the required materials at the bottom. Programs approved or provided by other accredited organizations, you can submit course objectives and content with their respective time frames. Submit a program flyer or marketing materials. Download and complete the GI-specific review form, and upload all required documents into the online application. ABCGN applications for review should include all of the following: course content, course objectives, program flyer, number of hours requested for each objective, and the total number of hours requested. Make sure the time frame for the objective is consistent with the total number of contact hours. Reviewers may request additional information from submitters. If there is a question about the content of a program, the concern is shared with all members of the committee and a group decision is obtained. For recurring programs, GI-specific approval is applicable for a 2-year period, starting from the date final approval is issued. Programs can be repeated without limit during this period, so long as the objectives and content remain the same. If the objectives or content is changed or altered, the program must be resubmitted. What is GI specific? Gastroenterology is a medical specialty focusing on the digestive system and its disorders. GI-specific content is identified as the knowledge a certified gastroenterology nurse is required to know to stay current in the field of gastroenterology. What is non-GI specific? That content is necessary for the education of any nurse, endoscopy or otherwise, is not considered GI specific. An example of this would include safe injection practices. All nurses need to be aware of safe injection practices, but this is not specific to GI nursing. For GI-specific criteria, aspects of the science of gastroenterology and hepatology include anatomy, physiology, and pathophysiology, diagnostic and therapeutic procedures, and diagnostic tests. An example of this would include pathology specimen collection specific to endoscopy procedures or to a GI diagnosis. GI-specific criteria related to gastroenterology and hepatology could also include research and technology, infection control, environmental safety, and standards of practice. An example includes standards as they relate to SGNA standards and guidelines and SGNA position statements. Disease processes that affect or are affected by the GI system, GI-related radiological procedures, or radiology use and safety in the GI lab. Examples include ERCP procedure, TIPS, and fluoro-guided dilation. Patient teaching, sedation, and monitoring, including capnography, cleaning, disinfection, and reprocessing of equipment and supplies, or universal precautions. So an example would be the use of PPE during procedures and reprocessing, care of infectious disease patients, handling of body fluid or tissue samples. Standards of nursing practice, OSHA, Joint Commission, and AAHC, electrosurgery, cautery usage and safety, laser training and safety as related to GI endoscopy. An example would include reducing infection risk associated with medical equipment in the GI setting, devices, and supplies. Pharmacology and nutritional therapy and enteral therapy. An example, infliximab, enteral nutrition, and parenteral nutrition therapies remain important for the treatment of Crohn's disease. Eating disorders and their effects. An example, eating disturbances before and after achalasia diagnosis and treatment, or special diets, such as those diets that would include diets that are specific to GI disorders, including low residue, high fiber, gluten-free, lactose-free, low protein, and low sodium. Bariatric surgery, gastric bypass, gastrectomy would be types of surgeries. The NOTES procedure, which is the natural orifice transendoscopic surgery, is specific to GI. Examples, surgery, post-op complications, ulcers or strictures, issues with absorption and or malabsorption, endoscopic issues post-surgery, as in the change of anatomy. Legal issues as they relate to GI endoscopy. Competencies as they relate to the GI nurse or staff. Performance improvement related to the GI lab. Examples would include scope filtering and scope reconciliation. Holistic care as it relates to the GI patient, such as lifestyle modifications for a patient with GERD, AIDS or HIV as it relates to GI endoscopy. Endoscopy is a valuable diagnostic tool for Candida, esophagitis, and AIDS-defining conditions. What is non-GI specific? On the other hand, the following topics, while they may be important in the GI practice, do not count as GI specific since they cover material not included on the GI examination. If there is a question about the content of a program, the concern is shared with all members of the committee and a group decision is obtained. The following subjects would not be approved as GI-specific contact hours: IV therapy, PQI or QA unless it's directly specific to GI, bronchoscopy, CEE, cardiopulmonary resuscitation, BLS and ACLS. Obesity as a general topic is not GI specific. Complications of obesity, such as diabetes and hypertension, are not GI specific. Benchmarking, most of this falls under management, which is not GI specific. To further elaborate, dealing with difficult people, humor in the GI lab, trendy diets such as the South Beach or Atkins are not GI specific. Just because GI is included in the title does not make the content GI specific. An example would be a titled presentation of my 18 GI feats. For GI-specific contact hours, programs provided by SGNA are not guaranteed as GI-specific. If GI-specific contact hours are not indicated, contact SGNA to confirm whether the program was approved by ABCGN. SGNA may be contacted at sgna@smithbuckland.com or 800-245-7462. After submitting your program, you will receive notification within 30 days indicating whether your program is approved for GI-specific contact hours. GI-specific approval cannot be granted until the contact hours are finalized. If your program is awarded partial GI-specific approval, the non-GI-specific content will be listed in your letter. GI-specific approval is valid for 2 years from the date your letter of approval is issued. Applying for recertification by contact hours. If a program was submitted to ABCGN for GI-specific approval, this will be indicated on the certificate of completion. If a program was not submitted to ABCGN, the content may still be considered GI-specific. Use your judgment based on the GI-specific criteria in the recertification handbook. Also retain all supporting materials such as handouts and brochures in case you're audited. Conclusion. All of this information needed for GI-specific criteria application and non-specific criteria and more can be found in the recertification handbook located on www.abcgn.org website. Thank you.